terminology called neurosis here. Here, my patient, her name is Maya. She is 35 years old engineer, married a bank employee, and actually suffering from type 2 diabetes. During the time visited my clinic with the following complaints. Her chief complaints were craving for food, fear of dehydration, dryness in the mouth, always feeling tired, trembling, crying easily. Also, she was having social anxiety, having more negative thoughts. I have taken a brief case history about Maya. Maya hailed from southern part of Tamil Nadu. Father was working as a medical representative and mother is a homemaker. And she is having two siblings, younger sister and brother. Due to her father's work, the family settled at Kollam, Kerala, where she studied in the nearby school and completed higher secondary examination. Afterwards, she has joined engineering college and completed her B.Tech with first class. Started working in a small firm in Kollam itself up to 2010, and she has been selected for a job in TC at Chennai, but she has developed a conflict whether she has to take up the job or not at Chennai, also having the fear of anticipating some kind of homesickness. However, finally she has joined TC at Chennai and enjoyed working as well as good company of friends. The part of the salary she used to send to her family and remaining amount she used to use for herself, which gives immense pleasure and more satisfaction for her. She got married during March 2015. Her spouse used to help her in each and every aspect. During weekends, they used to go for shopping malls, cinemas, restaurants, and temple, etc. She was very happy during this period. After 3 months of marriage, the in-laws came and stayed with them, which made her to feel uncomfortable because her mother-in-law used to say that Maya has to get up early and prepare coffee and breakfast before her husband gets up. She was not able to understand. She is also equally working in the software company as her husband. She is also having lot of occupational pressure. Thereby, Maya could not manage this dual role, developed stress and developed fear of facing criticism. Meanwhile, her husband developed illness due to high cholesterol, which availed many leave, which ended with loss of job. These circumstances made Maya to feel stress and developed mild depression also. After recovered from illness, her husband got a new job and started working. During this period, her mother-in-law kept on nagging Maya for not yet conceived even after 1 year of marriage, which made Maya to become more stressful, which made her to leave job and become a homemaker. After some time, she became pregnant. Meanwhile, again her husband encountered some problem in his job, which lead to minimize their day-to-day communication. Thereby, Maya became more stressful and depressed. Maya went to her parents' place for delivering a baby. Baby through the C-section delivery was conducted. Unfortunately, there was no proper milk secretion for breastfeeding. Thus, Maya made Maya to feel guilty and depressed. Neither her parents nor her in-laws could advise her in this aspect. So ultimately, the baby was not fed sufficiently, made the baby to cry more. At the fourth day, when they consulted the pediatrician, who became very much angry as the baby was not fed properly, which lead to underweight. Maya became more guilt, stressful and depressed, advised for formula milk for the baby. After completion of 3 months, she returned to her husband's place temporarily at Bangalore, jointly living with her in-laws. After some time, in-laws, they left Bangalore. Maya was taking care of the baby, which became more stressful for her. During 2019, she has been diagnosed as having hyperthyroidism, for which she has started homeopathy treatment. In 2020, during dinner time, she had giddiness and diagnosed as having hypothyroidism. And as per the advice of the doctor, she stopped all the medicine as advised by the doctor. After a few months, one day she felt giddiness, and for which she has consulted doctor. Her condition was diagnosed as hypoglycemia, which is significant for her, for her problem, which this particular diagnosis became a very significant for her, for which doctor advised her that eat something before going out. That particular statement strongly penetrated in her subconscious mind. Again, after some time, she has been diagnosed of having type 2 diabetes, which made her to become perplexed and made her to develop more stress, anxiety, which led her to be always preoccupied with her illness, and developed a core belief that the medicine prescribed for diabetes will bring down her sugar level, which leads to hypoglycemia. Hence, she wanted to keep on eating very frequently, which ultimately become craving for food. Further, she developed social anxiety, which made her to refrain from going out and meeting the friends and avoiding social gathering and family function, etc. After collecting the above information, myself explained about the treatment procedure to Maya and her husband, and taken their consent for their therapeutic procedure such as psychodiagnosis, counseling, clinical hypnotherapy, and psychotherapy. Totally 10 sessions were planned for all these procedures. Session 1. In order to find out our present psychological problem, there is a scale called Nov'21 was administered. The result revealed that Maya was suffering from significantly high level of stress, anxiety, and mild level of depression. From the case history and the psychological assessment, it is possible to say Maya is suffering from severe anxiety and stress related to her diabetes. She always worrying about her illness. She feels if she doesn't eat food, she may get hypoglycemia. That thought process made her to eat more very frequently. Therefore, her problem has been, that is the reason why I have diagnosed her problem as a diabetic neurosis. The, the therapeutic goals have been planned as follows: to control generalized and social anxiety, to control frequent eating, to stop the preoccupation about the hypoglycemia, to reduce negative thoughts and enhance positive thoughts. After the diagnosis and fixed the treatment goal, she has given psycho education, stated that diabetes also, although a physical disorder, suffers the impact of negative psychological stress, dysfunctional activation of autonomic nervous and endocrine glands. In fact, a variety of psychological variables have been found important in the metabolic control and management of diabetic patients, particularly regarding the adherence to self-care, taking the medicines regularly. Lifestyle therapy is the cornerstone of the diabetes. The therapist explained about the recognition of clinical hypnosis as a valid medical therapy by American Medical Association and Canadian Medical Association in 1958. Many research studies have been taken in this area. All these things have been explained to her. And this is the traditional, actually, hypnosis as a part of integrative treatment condition that traditional medicine has found difficult to treat a certain disease. Further explained about the hypnosis, not only remedy in medical condition, but also change the physiological pattern and has been effective in the management of diabetes, diabetic regulation of blood pressure, increased compliances, as well as actually the well-being of the adults. Further explained about the hypnosis, which increase blood circulation and decreasing diabetic foot problem of diabetic angiopathy. The hypnotherapy indeed serve as a motivational coach for belief and behavior. The increased suggestibility shown during the hypnotic be helpful in increasing complaints for exercise, diet, lifestyle changes required for diabetic management. In stress reduction that is associated with a better metabolic process, it is a tool for relaxation, decrease psychological morbidity associated with diabetes, and accurate wound healing foot ulcer. Further explained about the benefit of learning self-hypnosis, home practice, how it will enhance our sense of control, disease, enhancing treatment outcome. After explaining the different aspect, the session was terminated after fixing appointment next session. In this session 2, Maya reported for the session with a high level of motivation. The therapist once again explained about the significance of clinical hypnosis and assessed their hypnotic susceptibility by way of using head falling and found out that she is a good subject for hypnosis. Then made her to sit on a recliner and started the breathing awareness and the passive progressive muscular relaxation, that is PMR, for 20 minutes for relaxing her body and mind. Therapist observed her while in relaxation and given post-hypnotic suggestion stating that she will then carry this deep relaxation with her and use it whenever it is necessary during her awakening state. Also given the suggestion stating that she will go into deep trance whenever she is coming for next session. Then the session was terminated very gradually, asked us to open her eyes at the count of 5 to 1. The session was terminated after fixing the next session after 2 days. Maya reported for the session 3 with more interest after inquiring about her overall well-being. The therapist started the session with breathing awareness followed by PMR. In order to strengthen the trance, the therapist asked Maya to visualize the beautiful park where she sees the beautiful tall trees, beautiful green grass, and colorful flowers. To assess her level of trance, the hand levitation phenomena was established. Then the therapist introduced ego strengthening and ego purification script developed by Dr. Palan while she was in deep trance. Post-hypnotic suggestion given stating that she will experience the relaxation as well as the suggestion for ego strengthening which remain in her unconscious mind whenever she wants to use it during the awakening stage. Then the session was gradually terminated. The session 4. In the fourth session, Maya was taught 8 steps of self-hypnosis, also given audio version of breathing awareness, PMR and ego strengthening and ego purification script and motivated her to practice. Afterwards, the breathing awareness, PMR were given to take her into trance in order to check the depth of trance. Staircase technique was given, also established the phenomena of hand rigidity. After establish the deep trance, dynamic imageries, that is a butterfly image, which is mainly used for becoming free of unwanted feeling of shame, inferiority, anxiety, depression, and memories of painful past. The post-hypnotic suggestion given stated that you are carrying the suggestion given to your unconscious mind. Now, while it will be useful to shed away all your unwanted psychological feeling whenever you are in the awakening stage. Afterwards, that session was terminated. Then session 5, in the fifth session, the breathing awareness PMR were introduced subsequently to enhance the trance. Spark visualization technique again was used and hand levitation phenomena was elicited. Then the therapist introduced SIC, sensory imagery condition, as a behavior modification technique used for a situation-based problem and bring the change in the undesirable behavior and make it to form a new desirable habit of thinking, feeling, and behaving through creating specific sensation, rich images in our mind. Post-hypnotic suggestion, of course, given internal reality, now it will become an external reality. The naturally, so even in your normal waking state of consciousness, facing this situation, you will have desirable positive thoughts, healthy feeling. This would make your behavior, your action more appropriate as each day is passing. Afterwards, the trance was terminated gradually. The sixth session. In this session, after taking her into deep trance by using breathing and PMR, staircase imagination, and established hand rigidity phenomena, the script of the rational emotive suggestions developed by Alfred Ellis. I have referred the book of and that type. I have taken that particular script and I have given the script to her. Post-hypnotic suggestion in order to reduce her anxiety, that I have used this script. Post-hypnotic suggestion given to her stated that you will now release yourself from anxiety by yourself. You can always release anti-anxiety technique, which you will have listen now. You can accept yourself with your anxiety and stop telling yourself about the anxiety. I don't have anxiety. I will be very relaxed condition. I will give it up. The trance was terminated very gradually after this session. The session 7, the therapist assessed her overall well-being. Maya reported that she is very much better. The anxiety level related to diabetes has been significantly reduced, as well as her craving tendency for food also reduced. In order to induct the hypnotic trance, again, breathing awareness, PMR, staircase visualization were used and hand levitation phenomena elicited. After ascertained the depth of the trance, actually made her to visualize the social gathering where she is actively participating with others, chatting with others, cutting jokes, serving food, and taking food from the buffet type arrangement. During post-hypnotic suggestion, the therapist stated that you feel comfortable participation in the social gathering would continue in the real situation. You would be more relaxed outside the environment. She mentioned that visualization of the social gathering seems to be a real one. She could face the situation very comfortably. Then in the session 8, in this session, Maya has been taken into deep trance by way of using breathing awareness. PMR visualization elicited the hand levitation phenomena. The therapist introduced the following script related to anatomical structure and physiological functions of pancreases and the secretion of insulin. The following script has been given to her. The pancreases is an organ. This also visually shown to her before the trance, this particular diagram. The pancreases is an organ behind the stomach that is main source of insulin in body. Clusters of cells in the pancreases called islets produce the hormone and determine the amount based on blood glucose level in the body. Insulin is a hormone that is responsible for allowing glucose blood to enter cell, providing them with energy. A lack of effective insulin plays a key role in the development of diabetes. Insulin also assists breaking down the fats or protein energy. Insulin is a chemical messenger that allows cells to increase the level of blood from the, sugar from the blood, type 2 diabetes will develop. Islets cannot produce enough insulin to overcome insulin resistance. After this psychoeducation under the trance was terminated very gradually at the count of 5 to 1, fixed for next session. In the session 9, the suggestion was planned to give somatic healing after the core belief and feeling have been resolved. Maya has been taken into trance by way of using the usual, induction procedure. The visualization afterwards, all these things afterwards I have given. Then actually I have used a technique called inner healing technique. This is very, very much important here. The inner healing technique, this script I have found out. God, now I have given this script to her. God is operating on your pancreas's islets, turning like a very bare rock island to a beautiful tropic paradise, which brightly colored birds and green grasses abundance. Transformation of lifestyle is one of the ways to improve functionality of your body organs, including the exercise, stress reduction, weight loss, detoxification, some of the lifestyle modification that you have to follow. Exercising helping improve blood circulation. Exercising for at least 30 minutes a day helps in your overall health. It also helps regulating blood levels, blood glucose levels. Reducing stress makes your body release healthy hormones, including insulin from pancreas. Therefore, it helps in maintaining your blood sugar level. When you lose extra body weight, the pancreas stimulates insulin production. It helps in managing blood sugar in your body. Drinking green tea every day is the simplest way to detoxicate your body. Detox diet and supplement also help you to detoxicate your body. Additionally, it improves the functions, the pancreas to release insulin. Consuming certain dietary nutrients help in increasing production of insulin in your body, like bitter gourd, lady's finger, red cabbage, turmeric, fenugreek seeds, cinnamon. This type of information I have given to her during her trance. Starchy vegetables, whole grains, say for example, brown rice, oatmeal, quinoa, barley, etc. Then higher fiber foods, protein-rich foods, all these things, this is like a psychoeducation script I have given, all these things I have given to her during her trance. Then after the 9th session, the therapist made her to use all the direct and indirect suggestion while doing the self-hypnosis for 15 days. Then after 15 days, she has reported for the session 10. I have collected the feedback from her. She reported for session and given the following feedback. After undergoing hypnotherapy and practicing self-hypnosis, the condition have been improved. My fear about hypoglycemia significantly reduced. Craving for food decreased. Unnecessary anxiety about diabetes decreased. Emotional stability increased. I am able to go out to pick up my daughter from school, able to go to shop, attend some social function, and meeting interacting with other people. After taking the feedback, the therapist said she has improved a lot. Further therapy is not required now. As and when she required any help, she can very well approach the therapist again. Then the session was terminated. Thank you very much, sir. Thank you very much. It is my maiden attempt. Whatever I am expecting your criticism. Whether I have done it rightly or wrongly, I am not very sure about this. I welcome your very very much. You try to criticize my paper if you find if anything is wrong. So thank you very much for giving this opportunity. I want to thank the organizers of this meeting. Thank you very much.
Thank you, sir, for your excellent presentation. It is a good learning opportunity for all of us. That way, you have made an elaborate presentation of the history, and which is very important. And that way, we have explained each and every the details of the session structure. So it is going to be a learning experience, and not for students, even for us. Okay, so if anybody wants to contribute something or would like to ask something to sir.
Yeah, hello, Prashanta. Yeah. Can you hear me?
Yes, sir. Yes, sir. Continue.
Yes, sir.
Yeah. So I'll very fast. I'll go through one thing. It was really a very fantastic attempt and in a very right direction. Each and every step were very meticulously. Each and every session were very meticulously recorded.
Thank you, sir. Thank you.
I won't criticize it. I would appreciate it. Only thing is that this is an area which involves the combined approach because it being a medical condition.
Correct, sir.
So you rightly use the physiological approach where you described about the pancreas and everything.
Sir.
So there are technicality are little different from what are available on the net, and if the group wants, I can keep a separate session on how to handle the diabetes for the reversal. Yeah, yes, because this is a very short session. So I fortunately am a trained diabetologist, and I use it for reversal. I use it for reversing it. And fortunately, we have been able to reverse the insulins in 4 to 5 sessions of hypnotic trance, and taking a little different approach. So diabetes in the earlier years, when it is new, it can be very well handled, and it can be very well treated. It can be reversed. And this challenge as a hypnosis community, we must take to, so I am ready to actually deliver one more session on this.
Please,
those who are interested.
Yes, sir.
So
we will do it.
I really appreciate. I appreciate your work and your attempt, and you have rightfully done your best. And I again congratulate you for that.
Thank you, sir. Thank you very much, sir. Thank you very much, sir. I want to take feedback from our hypnotic guru Palan sir as well as Dr. Rakesh Jain sir.
Good evening, sir.
Sir, good evening.
Good evening, everyone. So,
yes, Rakesh, you're welcome. And you.
Yes, I was a bit late in joining towards the end. Still, I found it quite interesting, fascinating, and a learning experience even for me. I'm actually convinced that in general medical conditions, physical conditions, hypnotherapy can serve to a large extent. And the approach, the way you have treated the person, it is enlightening even for me. And also I'm delighted to learn that Dr. Avnish can take a separate dedicated session on diabetes.
Sure.
So
I'll be happy to do that.
Sir can schedule any day, at least one session on this particular topic. Thank you very much.
Yeah.
Thank you, sir. Thank you, sir.
Prashanta, some comments.
Sir, I made my comment. It was an excellent presentation. So it's a lot. It's a learning for me. And if Dr. Avnish is going to explain the procedure for a role of hypnotherapy in diabetes, that is going to be excellent. And I will recommend that if you can plan a webinar rather than keeping
very much,
yes,
we can do that
webinar, and we can campaign also as academy activity someday if you can plan that.
Sure.
So Nidhi, अगर आप लोग approve करेंगे तो I will request Nidhi to coordinate and when we can plan so that we can invite some of the medical personnel also some endocrinologist also, so
Yes,
that
yes.
Yeah. Very sure.
it can be
That will be wonderful.
possible.
We will plan something like that. I
Yes, sir.
appreciate that suggestion and input by Avnish. Dr. Santharam, it was really very good presentation.
Thank you, sir. Thank you, sir.
I'm very happy you used ego strengthening initially and then went on to work on psychology and then physiology both. So in a very systematic way, you handle this patient. Very nice. I'm very, very happy and satisfied.
Thank you, sir. Thank you very much, sir. Thank you very much.
Only one thing I found that, like sir,
And
Santharam
going
sir.
out.
Yeah, please,
Yeah,
sir. Please,
yes,
sir.
okay.
Please, sir. Sir, you are on mute. Yes, sir.
Palan sir has left, I think. Okay. Am I audible?
Yeah, yeah. Please.
Yeah.
Audible. Dr. Palan
Yeah.
possibly has a network issue there.
Yeah. So one thing that I would like to know, like the kind of work that you have done with this particular case, how much it was needed to go for assessment of the hypnotizability of this particular client using hand levitation or the rigidity. Okay, if you have not gone for it, what would have been the complications? If any, Santharam sir or anybody
Actually, for
explain this.
each session, I have planned nearly 40 to 50 minutes, sir. For each session, 40 to 50 minutes. Actually, before actually starting this real hypnotic, session, I prepared her mind. She has to understand what is hypnosis. Actually, she has to understand about the diabetes. That is the reason why I prepared the psychoeducation script in order to understand about the diabetes initially, then what are our treatment procedure, and actually what are our induction techniques. All these things I have explained. And I have taken her consent as well as from her husband also. I have taken the consent from her husband. Then step by step, I have followed all these techniques, sir.
Yeah. Here,
Yes,
something from my experience that
sir.
it was good you tried, the hypnotizability or the test for hypnosis. But
Correct, sir.
my experience, others' experience may be different. People who are more logically oriented,
Sir.
men especially, the males, we use more logic. And whatever is told, they have some kind of controversies to it, or some criticism is there in their mind for that.
Correct.
So in such cases, I have found that you need to demonstrate it every time. Usually in females, once their initial faith is set and our rapport building is good, then they tend to follow it quite religiously.
Okay. Yes.
Yeah, that's it.
Thank you, sir.
Yes, thank you, sir. Thank you very much.
Anybody else would like to contribute anything or like to ask anything?
So this is Meeta Shah.
Yeah, madam, please.
Yes,
Madam.
yes.
Haji. Sir, I just wanted to ask one question to all the dignitaries here. The case was wonderful, so you planned it very well. And so my question was that sometimes we do not even know if can we use these techniques also for narcissist clients. That was my query to all the dignitaries.
Yes. Yes,
Okay.
I think
Thank you.
that is possible. Hypnosis is very much effective in narcissism, and the person who has developed self-love and is denying interaction with the world outside, or sometimes he just feels that the outside world is not everything is about himself only. He is not able to connect to the others. So this techniques can be very well used for correcting this also.
Okay. Okay. Very good.
Thank you, sir. Thank you.
So once again, I want to thank the organizers and the participants, the senior people, for giving me the right feedback for my presentation. Thank you very much, sir.